Good evening, friends. I'm Dr. Venkatesh, our urology faculty from Team RRM Next and DocTutorials. And I'm a consultant urologist, renal transplant surgeon, and robotic surgeon from Kaveri Group of Hospitals, Hosur. Okay. So right now, like this is a orientation program. Most of you would have been aware that now the ever expanding platform of DocTutorials, we have started a general surgery residency program. I'm a consultant urologist. So general surgery residence program is one wherein we will be taking you all along through your 3 years of residency. So it's just like having your professors and all your teachers along, so that you can you can use the app in a more effective way to get the maximum extract out of your general surgery residency. Okay. Say, as you know, there are so much of doubts. See, everybody would have joined the residency after toiling through your NEET exams and NEET PG entrance exams. So basically, most of you would be aware that most of you would be aware that the first year of residency is going to be very difficult, especially in general surgery. Okay, because all of us have gone through. Even I had gone through. We had spent n number of sleepless nights. We'll be doing a lot of emergency duties, followed by a lot of admission duties. Then we'll cover trauma wards. Then we used to have duties of preparing patients for elective OTs and stuff like that. In between that, you have to do a proper you have to admit a lot of patients under your care. You have to see them. You have to clinically evaluate them. You have to identify, come up to a diagnosis. There will be a lot of challenging cases as well, which will be very difficult. So most of the times, what I've gone through our students, also what we had gone through during the residency itself is like, especially in the first year, you don't get adequate time to rest ourselves. That is one thing, and then you don't allocate adequate time to read on stuff like that. Okay, read stuff. So because you're almost all the time you are in the hospital, all the time you are in the ward. So people tend to believe that the learning process, that you are not hardly touching books and stuff like that. But here I would like to add a point. Okay. So far in MBBS, you have been it would have been a proper classroom teaching, and you go for clinical posting and stuff like that. Once you come to your PG residency, now the whole scenario changes. Both learning, reading, and operating, everything happens side by side. So most of your learning happens at the patient side, especially the bedside clinics. Okay, so bedside clinics. So here again, there could be a lot of disparity, because there would be some institutes which are really good. There would be few units which are doing really good. They used to take care of their residents. On the other hand, there could be, unfortunately, there could be few places where the residents are not taken care of, or because of sheer workload, the bedside clinics are has taken a backseat in it. So that is where we have devised this whole general surgery residency program to help those students, like where we'll take them hand in hand with us. So we will guide them through. We will guide you through all the 3 years of your residency. Okay. So now, if you go through the residency platform in DocTutorials, general surgery residency platform in DocTutorials, we have basically have a two major sections. One is wherein we have a whole of a theory part, and the next is basically our clinical discussion as well as clinical discussion. So in theory part, like what we are focused is like we'll be covering the basic chapters of all the your Bayesian law and Sabiston. So this will be helpful for you to crack through your theory part as well. Okay, that is your theory exam, that is your university the final year exams. You can easily crack through them just by watching the video lectures. You will get an initial core idea of what to do. That then you can go back and read your textbook. That is one point. Okay, and since we are also into preparing you guys for your NEET SS super specialty platform, there is always a touch on it. Okay, whenever you go through watch the lectures, we'll be always touching on those important areas which you are going to face in the NEET SS super specialty entrance also. So in that scenario, so that means you are also simultaneously not only reading for a theory part, you are also subconsciously you're also preparing for NEET SS. Okay, so remember this happens over a period of 3 years. Okay, that means you are not going to prepare for your NEET SS after finishing a residency. It starts on the day one of your residency. So that is the whole purpose of the thing. That is for the theory part. And especially when we have prepared the content for the theory part, we have given additional stress covering the previous university papers from different various universities, different previous DNB papers and DNB papers and MS General Surgery papers, and we have covered the salient theory questions as well. So in that way, it will be very easy for you to go ahead with it. But the most important and the most striking part of the whole residency programmers, we have this clinical scenarios. That is where this is the whole purpose of this residency was to help and guide those unfortunate residents who end up in a not so well structured teaching program units or certain DNB places where, or you are associated with a corporate hospital where the teaching is not in a structured module. There we are going to teach you everything from the basics. Okay, so you will be having a set of clinical examination videos. Like most of you would have been aware of the uh, good old textbook of surgical case discussion by Das. Okay, so we'll be covering all those things. We'll be dividing them into a lot of small segmental videos where you'll be taught how to examine a patient with a mass abdomen. How are you going to examine a patient with a swelling in the neck? How to examine a patient with suspected thyroid swelling? How are you going to examine a patient with a suspected swelling in the breast and all those varicose veins? All these things have already been uploaded, so it will help you. So instead of rather than just reading through the textbook, if you go and watch those videos wherein we are going to do actual demonstration through videos on it, which is being recorded and available in the app, that will help you to understand the clinical bedside clinics in a much better way. So it will be like a video library or video access of all those bedside clinics and examination point to that. Understand? Next is, apart from that, we have also added an initiative, and we have started adding a lot of recorded surgical videos also. So this will also be helpful. See, for example, see, obviously in your exams and stuff, you know what to do. You'll be asked questions about the operative steps of a basic procedure, like be it a hernia repair, be it a varicose surgery, or be it a thyroid surgery, etc. So most of the times you would have been observing from the operating end, you would have been assisting your professors and assistant professors, and sometimes you'll be doing under guidance also, which is the best way to learn, and there is no second thought about it. But for that also, will make you prepared for it for your residence. For example, you have got a case of a hemithyroidectomy posted tomorrow in your OT. So obviously you have to go through the operative textbooks to read them, so that it is busy. See, it all depends on how well you extract the resources from you. So there could be 5 residents along with you. Not everyone gets a fair chance of it, but you have to earn your chance. So how do you earn your chance? The better prepared you are, you can impress. It's not just impressing. You know that the assistants and professors, we usually have a knack. We can identify who are those residents who have come prepared for the procedure, who are known about the basic evaluation that the patient has undergone before we post the patient on the table, and how well you are prepared. So, for that matter, any surgeon who would who would prefer to have an assistant who is well prepared and who anticipates what is to be there. In that way, you can help your professor or assistant professor in surgery in a better way. That means you are likely to get better chances. Okay. So how we as a residency program in DocTutorials, we are going to help you out. Okay. So we have already recorded, and we have a library of common surgical procedures. For example, we have a surgical recorded surgical video of how a open hernia repair is being done. There is one more video where the thyroidectomy is being done. A step-by-step demonstration is there, wherein we have recorded with a lot of efforts and pains. We have recorded the whole surgical procedure. We break them into small parts. We describe them in detail. What are the anatomical landmarks? What are the important structures in it? So that when you go and see them in the operative table during your residency, during OT days, you feel like you've already seen it once, so you have that experience. It is easier for you to assist your professors and assistant professors. In that way, you will be better learned and better prepared. So remember, the better you are prepared to face the real scenario, it is easier for you to go through it. Okay. So in that way, we are going to help you in getting yourself prepared for and scrubbed for your so OT cases as well. Okay. So on basic, as I already said, we have also have a lot of video lectures on clinical examination. Okay. So previously you would have been aware that there is a lot of theory part. Theory part is still there, but for residency, the theory part has been refined by covering previous year questions where you have solved all the important essay questions or your 5 mark questions on that. So where we'll be jotting out the important points that will help you to crack through your university exams theory part. And over and above that, we are also going to touch upon the NEET SS, old NEET SS repeat questions and stuff like that. So you know which are the high yield areas among the entire part which is going to have a more weightage during a NEET SS exams. Okay. Right. And on the clinical section, we have covered the clinical examination points, how to do bedside clinics, and we also have a separate section where small bedside procedures, for example, placing an intercostal drainage, doing a pleural tapping, okay, or sometimes how to read a basic X-ray abdomen, basic chest X-ray. All these have been meticulously planned and it's been recorded. So whatever, so we make sure. So this is a collective effort, like myself, Dr. Rajamohan, and a lot of other faculties, like we anticipate what are the difficulties as residents you are going to face through your during residency. We are trying to help you out in every small possible way which we can address on it. Okay, so that is one thing. This platform is going to be continuously refined. We are going to add in a lot of other contents also. So if you have any doubts on it, any topics to be added also, we are very more than welcome. You can always contact us. It is this whole residency program is going to be keep on adding contents. We're going to add more operative videos. So me as a neurologist, I've already recorded a lot of common procedures like ureteroscopies, PCNLs, etc. So though that will be edited and it will be added in with a lot of voiceover so that we will help you to understand. Okay. And one more important thing, especially in the second year, where you go for your rotational postings, wherein you will be exposed to plastic surgery, you'll be exposed to pediatric surgery, you'll be exposed to urology, you'll be exposed to be surgical onco and surgical gastro, a lot of other stuff. So here is a major problem, especially in many places where you don't have a specialty, where you don't have a super specialty of that matter. Those students tend to lag behind compared to other patients, other residents where they have a well-structured, well-oiled super specialty department. So here also we want to make the ground level even, so that we have added lot of super specialty contents also. Remember, the super specialty contents not just from Sebastian and Bailey. We through our clinical expertise and knowledge over all these years, we are adding our own case scenarios. For example, if we take up urology, so I'll be adding on how to examine a patient with a renal mass, how to expect them, what are the clinical scenarios, and I will also touch upon common basic scenarios, how a BPH patient with a prostatomegaly is going to present to us, what is the clinical presentation, how do they present to you, and how to evaluate on them, and basic surgeries like a TURP, ureteroscopy and pneumatic lithotripsy, a PCN and percutaneous nephrolithotomy, RIRS. These are the common basic surgeries which you will be exposed during your specialty rotational posting. So all these things will be added. Similarly, in plastic, you will have a lot of aesthetic procedures like cleft lip, cleft palate, etc. So and a lot of flaps which as plastic surgeons they usually do in regularly in their specialties, which will be recorded and it will be discussed in detail to you. So in that way, like we are trying to make the level even for our residents across all the institutes across our country. Okay, so this is the basic gist of how the surgical residency is. Then if you have any doubts, you can ask me on that. And next important question is, sir, do we have adequate time to read? So how are we going to make them extract the maximum out of this surgical residency program? That is one question. So remember, you've got 3 years. The first year is obviously going to be very, very hectic because you have to do all the basic bedside works. You have to thoroughly examine the patient. So you have to do bedside procedure. You have to learn. You have to assess the in this scenario. I think already I've explained all those contents to it, but you have to find time. So remember, now with the mobile app, you have everything. Even if you get about 10-20 minutes, it is easier for you to go through the content because the contents are properly segregated and classified. For example, tomorrow if you have been posted for a case with hernia repair, you can just watch the surgery videos. Then you can go back and read the operative steps, etc. So it's not like you have to dedicate some 1 to 2 hours every day, sit and open and read about 10 to 15 pages of your textbook. That is not going to happen, especially in the first year. Understand? This process, the learning process itself is a very subtle process. The more time you spend with your patient, the more time you spend in your OT, the more time you spend in your ER rooms and emergency rooms and trauma wards, you are more likely to get extract out of it. Okay, there is always a time for you. When you go to your second year and third year, you will have a better time because you have juniors taking care of your ward works and stuff, etc. But remember, the first year is a golden period. I know it's a very tough time. You will have hardly have time to rest and feed yourself, but get the maximum out of it, extract the maximum out of it, because whatever we have seen and whatever I have understood is those who have spent a pretty good decent time and a very sincere in the ward in the first year has definitely come out in flying colors at the end of your exams. Not just the exams, also in your subsequent clinical practice as well. Understand? So that is one thing, one piece of advice I would tell to all the first year residents who's joining or who's just currently entered into your surgical residency. That is one thing. So obviously, second year and third year, you will find your way. You will have a decent time to read about it. In that way, you can always prepare it. Okay. So this take the surgical residency. It will be like a you have your Sebastian and Bailey, and we are here with all the video lectures and contents which will aid you to read your Bailey and Love and Sebastian in a more efficient way. That is the whole purpose. And we are also going to add upon the clinical points, the surgical videos, all those small bedside procedures which has never been introduced in your textbook, which you cannot understand through textbooks by breaking them into small components, and we are explaining through our periods of our clinical expertise and experience in it. Understand? So I wish all the very best for all the residents, because this I feel is a very great initiative from DocTutorials, and this is going to be a real will be going to be really helpful for all the residents across the country. Okay, right. So I'll be there online. So if you guys have any doubts or anything else, I'm there to help you out. Okay. So if you have any doubts or anything, you can always put it in the chat box. I'll try to guide you out. And any other suggestions, for example, you need certain topics to be discussed. If you have any other things, we are always there to help you out. Okay. And apart from the residency contents as well, we are always there. Almost once in 2 weeks, we are going to come out with some live sessions. We are going to interact with you, all those subscribers, so that you can have a one-to-one conversation with us. So we will help you all through the 3 years. Okay. So remember, these 3 years are the most precious time in your career. This is going to shape your career. So far, whatever you have learned through your MBBS is a basic general medicine and general surgical part. But from now on, your career is going to be built upon from this. Okay. So as I already always say, spend the maximum time in it, and most importantly, especially in the first year, take care of your health. Take whatever be little time spend, try to take nutritious food, don't try to skip your meals, take care of your health really well. There are few places in the first year, especially the first 6 months to 1 year, is going to be really tough. Sometimes it can be toxic, but don't worry, everything passes on over a period of years. Okay, so need not bother about it. We are always there. Apart from the surgical point or theory point or whatever stuff, if you have any other issues also, we are always there to help you. You can reach us. I think most of us would have some of our contact numbers, or through DocTutorials also you can reach us. So whatever by small little means and ways, we are always there to help you out. So any queries on this? So I would advise you to just go through the contents, because I have just given only the bird's eye view of it. Okay. So once you go through them, then you will know what the impact this residency program will help you out. Okay. I think Vinod has some doubts like. That's what We are always open to all the suggestions. If you want some other topics to be added, we will be always coming out with this. Our main motive is to help you out through this. Okay. And most importantly, by the end of 3 years, you should be simultaneously being prepared for your for your NEET SS also. So instead of rather than sitting there, sitting and taking a break and preparing for it, we want you to get the maximum extract of all through your residency, and then you can crack the exam immediately passing the exams as well. Okay. And since you are going to interact with all the super specialties over here in this platform, you will also will have an idea how what super specialization if you are interested to join up, so how things will be like. That will also be an eye opener. Okay. Because many times what I feel is in few places where there is not much exposure to super specialties, they would have done a general surgery really well, but again there will be a doubt. So what to expect out of the super specialty? So what will be the case scenarios? What will be the prospects of doing that particular super specialty, be it MCH or DNB? So in that way also we are there. You can go through the content because we have made the super specialty content in such a way. Such a way that you can always which will be beyond the scope of your Sebastian and Bailey, but it will be sufficient enough for you guys to understand and get a grasp of the super specialty. Vinod, are you there? Vinod, are you there? So anyone from DocTutorials? Okay, then. So you can always get back to us with your inputs, with your doubts as well. We are always there to help you out. So first of all, congratulations to all those who have joined your residency this year, and all those for those who have been all the best for those who have already been into the residency and you subscribe for our program. This will be really a eye opener for most of you. In all small subtle ways, we'll be there to help you out. Okay, right. So with this note, I will wind up this session. So this we will come back with every once in 2 weeks. We'll come back with some live sessions, and based on your requests also, we will do some live sessions also. And we are going to refine and add up your content in the residency program as well. So wish you all the very best. Take care of yourself, and the health is very important, especially in the first year of residency. That's what I used to get a lot of queries and messages from students after joining. It be very difficult, etc. Remember, nothing stays long. So so there is a saying like when things go tough, the tough gets going. Okay, so always do well. So and the tough times are always will man up, and you will end up having a good positive time with you. Okay, so thank you so much.